The pectoralis major is one of those muscles that we tend to not see symptomatically all the time, but it's incredibly important for postural reasons. And we're going to be taking a good look at that. The fibers are actually coming off of the clavicle and off of the sternum and off of the ribs out to the humerus. And when they shorten and tighten, we get a round-shouldered type of a posture. Now, what's really interesting is the pain pattern going down the upper extremity, because when it goes down the left side, it can mimic the pain that a person might be having a heart condition. And one of the things that's important in that case is to make sure they've already been worked up and checked out for any kind of heart problems. So Dr. Sella didn't test this muscle at the trunk, but when he tested at the shoulder, it was interesting that it never showed up amongst the muscles that did the first 50% of the movement activity in the muscle. So that was a really interesting point. And so it's much more of a postural control muscle. So the postural clue you're going to get is that round-shouldered posture, telling you that you need to take care of the pectoralis major. Diagnoses that you might see with this are angina or upper extremity types of pain, and it responds incredibly well to spray and stretch. Let's go do that technique now. A really good way to evaluate the pec major and minor together is to look at the patient in supine from the head of the table and see if one shoulder appears to be higher than the other. The less space between the back of the shoulder and the table, the better. Oftentimes both sides will be elevated, but oftentimes one worse than the other. So we would work both the pec major and the pec minor in order to bring those shoulders back. In treating the pec major, what we're going to want to do is treat in three different directions. We're going to treat the fibers that are coming from the clavicle across. Secondly, we're going to want to come in a position where we can treat the sternal fibers as they come across. And then as we come up higher, we want to get the more fibers coming from the costal area. The treatment of each one of these is going to dramatically relax the shoulder, allowing it to come backwards. In our patient right here, as I evaluate, the right side seems to be elevated, so I'm going to need to come over to the other side to actually do the technique on the side where he needs it most. So we're going to spray, first of all, the fibers down here that are coming from the clavicle down. So go ahead and turn the head to the side, and deep breath in through the nose, and exhale, starting at the area of the clavicle, going through the muscle, all the way down. Again, deep breath in, and exhale, and making sure that we're taking up the slack as he releases. And again, deep breath in, and exhale. Again, notice how the spray is going through the clothing and disappearing as we do the treatment. There we go. Once we've taken through that position, what we want to do is we can stretch this passively in the same position, following it, just like that. Now we're going to come up to get the sternal fibers, but before that, I need to rewarm the area. Okay, now the sternal fibers are our next fibers to treat. I want the arm to be parallel with the shoulder. I'll be externally rotating as the patient exhales. I'll go ahead and look to the opposite side, and deep breath in, and exhale. Right across the front of the chest and right on down the arm. Again, deep breath in, and exhale. Notice I keep the spray can far away. And again, one more time, deep breath in, and exhale. Very good. And again, we can just emphasize that stretch. And then we're going to come back and rewarm the tissues. Our final fibers are the costal fibers as they come up here laterally. Very important because of their attachment points down into the rectus and even the continuation of those fibers fascially over to the adductors. This can be very important in sporting events like throwing a ball. So what we're going to do is externally rotate. Go ahead and look over to the side. And deep breath in, and exhale. Again, making sure to go through the muscle and through the pain pattern once again. Deep breath in, and exhale. The other thing that's important is your position as a therapist to not hurt yourself. So I'm trying to be very careful here. Deep breath in, and exhale, making sure that I'm not hunching over while I'm doing this work with the patient. Got a good stretch on this, which is going to be really important. I'm going to go ahead and bring the heat back over now. One of the important things about doing this whole thing is a follow-up stretch that they can do at home. And I often have them do the doorway stretch. They'll be standing in the door frame, but we can actually take them through the positions here that they would be doing at home and practice on the table, where we come into our first position here, our second position, and our third position. And people can do this on either one side or both sides in the doorway. So very important aspect they need to learn. They can learn it first on the table and secondly standing in the doorway.